Let's discuss on enzyme uses and with much emphasis on to the clinical enzymology because we all know enzymes are very, very useful in the industry besides their important role in the clinical field. Like they can act as a therapeutic agent, they act as an laboratory reagent. So vast applications of enzyme both in industry as well as in medicine. So today's topic of discussion, comprehensive discussion, is clinical enzymology. So clinical significance of the enzymes. Certain enzymes are used for diagnosis of the disease. They may be used as an therapeutic agent or as an analytical reagent. So what is the diagnostic use of enzymes? Enzymes can be categorized into the two categories. One are the plasma specific enzymes, second are the plasma non-specific enzymes. Specific means they are many functional enzymes are present actively into the plasma in significant concentration, and they are derived from various tissues or the organ side, and they are poured into the plasma. And for examples, many blood coagulation, the proteins as well as many immune proteins are there. Then plasma non-specific enzymes are those which are generally not present in the blood. They are non-functional enzymes in the plasma which are coming out from the cells of various tissues due to the normal wear and tear. So their normal level into the blood is very, very low, and but it drastically increase during cell death, like in necrosis or in proliferation of the cell, or some disease conditions like leukemia or other kind of neoplasmic diseases. So therefore, the assay of these enzymes are very, very useful in diagnosis of disease. So the plasma specific enzymes are, as I've already told you, these are the blood coagulation proteins. Like peroxidase is there, pseudocholinesterase is there, lipoprotein lipase is there. So they are evidently present into the blood. These enzymes are clinically of interest when their concentration is decreased instead of their high concentration, because they are already in significant amount. The plasma non-specific enzymes are present in very high concentration into the tissue side, but not in the plasma. And the estimation of these non-specific enzymes are very important for the diagnosis of several diseases. Now, we will take up the example of alanine transaminase, which is one of the important diagnostic enzyme, or it acts as a biomarker of the liver disease. Here, I would like to explain what is a biomarker enzyme. Biomarker enzymes are first we will discuss like what is the biomarker. It is defined as the one naturally acting molecule or a gene characteristics of which by which a particular pathological process can be identified. So here the enzymes, we will see many enzymes, and their concentration assessment will give a diagnostic clue about some diseases or disorder. So we have taken the example of alanine transaminase, one of the important enzyme of liver diseases. Its another name is glutamate pyruvate transaminase, and the plasma ALT normal value for the adult is 10 to 40 units per liter, and this level is elevated in many liver diseases, for example, viral or toxic hepatitis, in jaundice, and in cirrhosis of liver. Then aspartate transaminase, that is also known as SGOT or glutamate oxaloacetate transaminase. So the plasma AST concentration is around 10 to 30 units per liter, and it is moderately elevated in liver diseases, and it is significantly increased in the after the myocardial infarction. So the plasma AST level starts increasing after 6 to 8 hour of attack, and after the onset of chest pain, and with the peak value reaches right from 18 to 24 hours, and the value falls to normal level within 4 to 5 days. So this is the trend of SGOT or AST, that is aspartate amino transferase. So AST needs pyridoxal phosphate as a coenzyme, and it is a marker of liver injury and shows the moderate to drastic increase in the parenchymal liver diseases like hepatitis or malignancies of liver. AST was used as a marker of MI in olden times, but nowadays there are good or more significant markers than this. So, like troponins, we'll discuss later on. Then alkaline phosphatase. Alkaline phosphatase, what is its function? It hydrolyzes the organic phosphate at alkaline pH. So the normal serum level for adult is 3 to 13 king angstrom, kilo angstrom units per DL, and it is elevated in certain bone diseases and the liver diseases. So very high level may be noticed in obstructive jaundice, bone diseases such as Paget's disease, rickets, osteomalacia, carcinoma of bone, and hyperparathyroidism. So, like its level, if it is increased, moderately increased, like 2 to 3 times increase in ALP level is seen in hepatic diseases such as infective hepatitis or alcoholic hepatitis or hepatocellular carcinoma. But very high level, that is 10 to 12 times of the normal range, has been observed in extrahepatic disorders or obstructions. So, like in obstructive jaundice caused by gallstone or by pressure onto the bile duct, by carcinoma of head of pancreas. Then intrahepatic causes can be, they may be due to the virus or infective hepatitis or by drugs like chlorpromazine. So ALP is produced by epithelial cells of the biliary canaliculi, and obstruction of a bile with consequent irritation of the bile cells leads to secretion of this ALP into the serum. And that's how the drastically high level is found in the obstructive jaundice. And beside 10 to 20 times higher level of this ALP has been observed in bone diseases where the osteoblastic activity is enhanced, such as in Paget's disease, rickets, osteomalacia, metastatic carcinoma of the bone, and hyperparathyroidism. Then acid phosphatase. What is the importance? It hydrolyzes the phosphoric acid ester at pH 5 to 6. The normal serum value for the ACP is 0.5 to 4 kiloangstrom unit per DL. The acid phosphatase enzyme is useful for the diagnosis and the prognosis of prostate cancer. ACP is therefore an important tumor marker. It is an important tumor marker. So one thing I would like to quote about, which I forgot to tell, that is the ratio of AST to ALT. That is very, very diagnostically important, and it gives important clue to the etiology of underlying liver diseases. For example, if the ratio is less than 1, it shows some hepatitis or some liver diseases. If it is greater than 2, it has been observed in alcoholic liver disease, or less than 1, I've already told, it is in chronic hepatitis or chronic cholestatic syndrome. So this ratio is equally important as the assessment of separate concentration of ALT and AST. Now, amylase, it catalyzes the hydrolysis of starch and glycogen. The normal serum value is 50 to 120 units per liter. The activity of serum amylase is increased in acute pancreatitis, chronic pancreatitis, mumps, and obstruction of pancreatic duct. Besides, there is a serum lipase. That is also one of the important marker of pancreatic disease. And then creatine kinase, then lactate dehydrogenase. These are important clinically diagnosed clinically important enzyme, and they have much value in the diagnosis, especially of the diagnosis of heart disease. Now here there is a table which shows a number of diagnostic enzymes, where they are located and what is their clinical application. Like the acid phosphatase, so it lies in the prostate and erythrocytes. It is important in the prostatic cancer. Its serum level of these acid phosphatase increased in drastically in the prostate cancer. Then alanine transferases, all these enzymes are maximally, they are plasma non-specific enzyme, means they are tissue specific. Then alanine transferase, that is the ALT, it is important for liver, skeletal muscle, and heart, and its importance in hepatic parenchymal disease. Similarly, aldolase, it lies in the skeletal muscles and heart, important for diagnosis of muscle disease. Then alkaline phosphatase for liver, bone, kidney, intestinal mucosa, and placenta, and special clinical application in diagnosis of bone disease and hepatobiliary disorders. Then amylase, it is found in salivary gland and pancreas, so pancreatic disease and peptic ulcer. Then aspartate transaminase or SGOT also. This is known as liver. This is present in liver, skeletal muscle, heart, abundantly present in the heart tissues, kidneys, and erythrocytes. Important for diagnosis of MI, myocardial infarction, hepatic parenchymal diseases, muscle diseases, and anemia. Then cholinesterase, it is present in the liver tissues, and its importance is in organophosphorus insecticide poisoning, hepatic parenchymal diseases. Then creatine kinase, it is present in the muscle, skeletal muscle, brain, heart, and smooth muscles. Importance in the myocardial infarction and the muscle disease. Similarly, the gamma glutamyl transferase, it is present abundantly in the liver and kidney, uh, hepatobiliary diseases, and alcoholics. Alcoholic patient will have no a drastically high level of gamma GT. Then lactate dehydrogenase, it is present in the heart, liver, skeletal muscles, erythrocyte, platelets, and lymph nodes. So many isoenzymes, especially the LDH4 and 5, they are important for the liver diseases because they are abundantly present in the liver tissues, while the LDH1 is abundantly present in the heart tissues. Erythrocytes, platelets, and lymph nodes. Then it is important for myocardial infarction, hemolysis, and the hepatic parenchymal diseases diagnosis. Then 5' nucleotidase, it is important for, it is present in the hepatobiliary tract and importance in the hepatobiliary diseases. Similarly, PSA or prostate specific antigen. So beside acid phosphatase, it is also one of the important marker of the prostate cancer present in the prostate. Similarly, trypsin is an enzyme which is present in the pancreas, secreted from the pancreatic tissues, and it is important in pancreatic disease and cystic fibrosis. Besides amylase, the lipase, pancreatic lipase are also very diagnostically important for pancreatic diseases. Then enzymes as a tumor marker and their associated disorders. So this is aldolase enzyme. It is important for liver, cancer of liver, alkaline phosphatase for the cancer of bone, liver, leukemia and sarcoma. Then placental alkaline phosphatase, it is important for the marker for ovarian, lung, gastrointestinal and Hodgkin's disease. Amylase is for pancreatic disease. Creatine kinase is for prostate, lung, breast, colon and ovarian disease. Gamma GT for liver disease. LDH for liver, lymphomas and leukemia. So there are various isoenzymes of this LDH. Similarly, 5' nucleotidase for liver, PSA for prostate, and prostatic acid phosphatase for prostate cancer, both for prostate cancer. Now, enzyme assays in the myocardial infarction or the cardiac markers, we can better call them cardiac markers. So, a biomarker is a clinical laboratory test which is useful in detecting the dysfunction of an organ. So, cardiac markers are used to detect the cardiac disease. So, this is the panel of the enzymatic markers, which is important for diagnosis of heart diseases. So, like your creatine kinase, not creatinine, then lactate dehydrogenase, serum aspartate, aminotransferase, which is also called as SGOT or serum glutamate oxaloacetate transaminase. Beside all these are the non-enzymatic proteins like myoglobin and cardiac troponin T and I. So TNT or TNI. So these are the cardiac markers with time course after the onset of myocardial infarction. So this is the CKMB, abnormal activity detectable. These are the Rs in the from 3 to 10 hours. We can see the drastic elevation of these CKMB into the plasma. Then time for maximum rise is 10 to 24 hours. Within 24 hours, it reaches to its peak level, then returns to the normal level in 2 to 3 days. Then SGOT, its level starts rising from 6 to 12 hours. Within 24 to 48 hours, it reaches its peak value. And from 4 to 6 days, it returns back to the normal. The LDH, especially the LDH1 isoenzyme, its level is starts rising from 8 to 16 hours after the MI and the MI and it reaches to the maximum value of 48, yani though from 2 to 3 days it reaches to peak value and 7 returns to normal from 7 to 12 days. Similarly, the myoglobin, it reaches earlier. It starts rising from 1 to 3. It is the one marker which is the earliest one to starts raising into the blood, and the peak value reaches from 6 to 9, and within 1 day it reaches come back to normal, but it is non-specific, so that's why it's not a very useful marker of the heart disease. Then trop I and trop T. So the trop I, its levels start rising from 3 to 8 hours, and within 24 to 48 hours, means 1 to 2 days, it starts it reaches to its peak value, then again returns to the normal from 3 to 5 days. Similarly, trop T or the troponin T, its value starts rising from 3 to 8 hours, and from 78 means 72 means 3 to 4 days starts reaches to peak value. So till 4 days, we can detect its peak value. Even after the 4 days of the MI attack, we can detect the drop T, and it reaches to the normal from 5 to 10 days. So the same trend has been shown graphically. So CKMB is the earliest to reach the these are the all enzymes. So CKMB is the earliest one to reach to its peak value. Now, enzymes in the liver diseases. So, enzymes, much I have already discussed. Just I am reading out the enzymes in the hepatocyte damage. These are the aspartate aminotransferase or AST. Then alanine aminotransferase or ALT. Right? ALT is the more liver specific enzyme than AST or SGOT. This is SGPT, this is SGOT. So this is more specific to heart disease, while this ALT is more specific to liver. Then enzymes in the cholestasis, these are alkaline phosphatase, 5-nucleotidase, glutamyl transferase, very, very important for alcoholics. Then enzymes as in pancreatitis, serum amylase, urine amylase, and the lipase, serum lipase. So the use of enzymes in the laboratory investigation, like alcohol dehydrogenase for investigation of ethanol, lactate dehydrogenase for lactate, then glucose oxidase and peroxidase for glucose estimation, hexokinase or glucose 6-phosphate dehydrogenase for estimation of creatine kinase. Then uricase for uric acid estimation, urease for urea, cholesterol oxidase, peroxidase, what we call as GOT pod. And this is GOT pod, glucose oxidase and peroxidase. It's for glucose, and GOT pod is for cholesterol estimation. Then lipase, glycerol kinase, and glycerol phosphate dehydrogenase enzymes are for triglyceride estimation. So these are the various enzymes and these are the various substrates. So they form the basis of various enzyme-based assays. Then therapeutic uses of enzymes like asparaginase, it's used for leukemia, chymotrypsin for inflammation and edema, then collagenase for skin ulcers, fibrinolysin for blood clots, then glutaminase for leukemia, hyaluronidase for heart attack, then lysozyme for as an antibiotic, rhodinase for cyanide poisoning, then ribonuclease as an antiviral, beta lactamase for penicillin allergy, streptokinase for blood clots, then trypsin to dissolve the blood clot, uricase for gout, and urokinase for blood clots.